Fertility is a complex issue, and in this video we are going to go through some of the basic information about how the egg and sperm come together to create new life. Then we'll look at the mechanisms of fertility, firstly in women, then in men, and see what can go wrong. We'll suggest a few ideas that can help improve fertility. Each month, one ovary usually releases one egg. Textbooks tell us that this tends to happen on day 14 of a woman's cycle, 14 days after her period began. But this is not always true. Some women might ovulate on day 8, some might ovulate on day 20. Once the egg has been released, it travels to the fallopian tube where it lives for between 12 and 24 hours. Conception is possible if sperm is already present in the fallopian tubes when the egg is released, or if a woman has sex while the egg is alive, allowing sperm to swim up through the uterus and into the fallopian tube. Sperm can reach the egg in as little as 30 minutes. Although we usually think of the sperm doing all the hard work of fertilization, penetrating the docile egg, it is now believed that the egg actually chooses which sperm she lets in or not. Research has shown that the egg has a much more important role than previously thought, and that she is in fact quite selective. The egg appears to give preference to sperm with intact DNA and produces a compound that softens the outer layer of the egg to allow specific sperm to enter. These studies also suggest that the egg may even actively bind sperm to its surface, trapping the sperm it has chosen and not giving the sperm any choice in the matter. Once the sperm has made its way in, the outer layer of the egg hardens, which prevents entry to any other suitors. Though the egg has a lifespan of less than a day, sperm can stay alive inside a woman's uterus and fallopian tubes anywhere from 1 to 5 days. This means that sex up to 5 days prior to ovulation can actually result in pregnancy. The lifespan of the sperm is dependent on the sperm's health, but also on the woman's cervical fluid, which can nourish the sperm during its wait. If conception is successful, the newly fertilized egg will travel out of the fallopian tube and implant into the uterus 6 to 10 days later. If the egg is not fertilized, it will simply dissolve and pass out with the menstrual flow. It is worth noting that there is only a 15 to 25% chance of getting pregnant each cycle, even with perfect timing. What is certain is that fertility rates worldwide are dropping quickly. One reason is that many women are choosing to have children later in life and to have fewer children, while other women are having difficulty conceiving either because they are having fertility problems or their partner is. We'll talk about women's fertility first. As I mentioned already, a woman normally releases one egg each cycle. A cycle starts the day a woman gets her period and ends the day before she gets her next period. The first day of her next period is the first day of her next cycle. A cycle on average is said to last 28 days, but a healthy cycle can last anywhere from about 24 to 35 days. If your cycles are longer or shorter than this, it will be a good idea to consult your doctor and discuss this. The first part of a woman's cycle is from the first day of her period to the day of ovulation. This is referred to as the follicular phase. The second part is the luteal phase, from ovulation to the start of the next period. If you are concerned about your fertility, it is recommended that you check first of all if and when you are ovulating each month. If you are ovulating earlier or later than you thought, then you might not be timing intercourse correctly to fertilize the egg. If you are not ovulating, you are not producing an egg to be fertilized. You can track your ovulation pattern a number of different ways, which we'll explain in another video. It is also important to maintain a healthy weight if you wish to become pregnant. If you are underweight, your body will not think it has enough energy to support a healthy pregnancy. If you are overweight, it may interfere with your hormone balance and thus your fertility, though a lot of women who are underweight and overweight do become pregnant. A diet that does not give your body all the nutrients it needs may also affect your fertility. We'll give you ideas for healthy foods later on in this video. Now, male fertility. Male fertility centres around the production of healthy sperm. The main issues with sperm are when there is not enough individual sperm, poor morphology when they are not the right size or shape, and when they have motility issues, they can't move fast enough. Here are a few basic suggestions to improve both male and female fertility. Stop smoking. Avoid alcohol if at all possible. A glass or two of wine or beer per week is probably okay, but the less alcohol you drink the better if you wish to conceive, and also for health in general. This applies to both partners. If you take prescription drugs, it would be worth talking to your doctor to see if these medications might have an impact on your fertility. If you abuse any other drugs, this may seriously compromise fertility and overall health, and again, this advice is for both partners. Eat a high-quality diet. The body is mostly water. The rest is mainly fat and protein. If your diet is high in sugar and processed food, your body will be micronutrient deficient and therefore will be a lot less likely to be fertile. If you eat quality fats like wild fish, healthy animal fat, eggs, coconut oil and avocados, you will supply your body with the nutrients necessary for healthy sperm and egg production and later for fetal development. Saturated fat and cholesterol are also the building blocks for hormones, so without adequate fat consumption, hormone regulation will be off and the signalling mechanism of the body will be less effective. This is equally true for men and women. If you do not have an active lifestyle, then you are indicating to your body that you are not healthy, as all healthy organisms must move. Aim for 30 minutes of low intensity exercise every day and 15 minutes of higher intensity twice a week if you are not exercising right now. High quality supplementation can also have dramatic effects on fertility. Other treatments like acupuncture, massage and mindfulness practice can also help. For more health tips and information, subscribe to our channel.